sent a message.
And I introduced you, Miriam, right?
Yep. All right. Oh, Mike says that he's on, but not as a presenter, so he's here. Interesting. Let me. That'll work anyway, right?
I'm going to make him
Okay, good. Thank you.
panelist. Yep.
Thank you.
And we have about 23, 24 people right now. 25.
Good.
Are we supposed to start right at noon?
Yep.
Okay.
Yeah. All right. And we're recording this and
perfect.
Yep. All right. And I will righty. Yep, and we are live.
Great. Hey, Mike.
Yep, good morning.
How are you?
Good, good. Here at the Louisiana Society for Respiratory Care annual conference.
Oh, nice.
Good conference.
Nice.
Hey, and we're recording, and I think we're live. Is that correct, Liz?
Yep,
okay.
We are.
We want to wait maybe a couple more minutes for folks to file in.
Yeah, we have about 33 people, and we had almost 60 people registered, so.
We'll wait a couple more minutes.
Sounds good. Okay.
Looks like we're holding steady at 33.
Yeah.
I'll wait one more minute, see if we can have two more people pop on, at least. Oh, we lost one. Wrong direction, folks.
Then we just gained two back.
We did get two back. So you lose one, you get two. We're good. All right. I will go ahead and kick this thing off. I'm Dan Garrett. I'm the executive director for AARC. I was scrolling down to see who's on, and I know quite a few of you. So it's nice to see your name on there, and we're glad you could join us today. We are here to kind of tee up our upcoming Washington fly-in, and it's very exciting because this year we, have the SOAR Act to really go up and present a strong case for oxygen reform, and I'm just so optimistic about this fly-in particular because it's really going to be a substantive fly-in when you actually have a bill and a number that you can, present to the member of Congress, whether it be Senate or House. So it's very exciting. I wanted to also just take a minute to say that the fly-in is a really great opportunity for us to really collaborate as one organization. While we may be spread out throughout the country, we all are committed to the same core issues that impact respiratory care. So it's nice to have everybody united in one front, collaborating together, all on the same page. It's kind of the magic of what we do when we all get together as a collective. Never doubt how many people can get something done. I think Margaret Mead, I'm kind of destroying her quote, but you get my drift. Everybody should know that quote, and I've completely ruined it. Nonetheless, I'm getting over a bad cold, so I'm going to cut my remarks and toss to Miriam O'Day, our Senior Vice President of Government Affairs, and she's going to take us into the meat and potatoes of what we're going to be experiencing as we come into Washington in just a few short weeks. Miriam.
Thanks so much, Dan. It's really my pleasure to be here today. This webinar is the request of our advocates. People want to make sure that they feel prepared when they're headed to DC, that they know what the issues are, they know what to expect, and they have a nice overview. So we've put together a small program for you. Liz, are you going to put up the
agenda?
The agenda. So I'm really happy to be joined here today by Mike Madison, who is the chair of the Government Affairs and Advocacy Committee for the AARC. He's one of our great volunteers. And Liz Morrison, who is my colleague from communications. And Liz is going to go through the online tools and show you a little bit about how we've been able to update the website. I know this is something that people have been asking for, and we finally have it done. And we hope that you'll find the tools useful. We'll have some additional pieces actually that we'll add to the toolkit before we get to DC. But let me turn it over to Liz, and then she'll come back to me and I'll do an issue briefing. Thanks, Liz.
Absolutely. Let me pull up my screen here. All right. All righty. All right, so really excited about this. I'm going to give a lot of credit to Miriam, though. She has spent a ton of time putting together resources for everyone and making it easy before we get to Washington, D.C. So a lot of credit goes to her. Also, special thanks to our sponsor for the fly-in, Aerogen. They've been great as well. But we will get into the meat of it here. Alrighty, so this is really exciting and something we've been working on for a little bit. We've made a lot of updates to the fly-in page based on feedback from years past to include resources that you'll need before you get to the fly-in and even while you're there. So the first thing, and I've circled it in red here, is when you go to, you'll go to the advocacy page and go to the drop-down menu and the AARC Respiratory Care Fly-In Day Washington, D.C. landing page. And everything that you're gonna need is on the right-hand side over here. The first thing, it's all-encompassing. It's the Respiratory Care Fly-In Toolkit. It's 17 or 18 pages, chock full of all of Miriam's amazing tools and assets. So absolutely be sure to download that. That's going to be really helpful for you before you get there. We've also broken it down into individual documents if it's a little easier to digest. So things like background on oxygen reform, talking points, setting up meetings, travel information. A lot of people had requested that in the past as well, because getting around Washington, D.C., if you've never been there, it can be a little difficult. I'm a DC native, so for me, it's a little easier. I love the metro system, and I promise you will too once you get used to it. And I guess kind of going right into that, we will go over talking points. So Miriam has gone through and created a lot of great talking points for you guys. This is just a sampling of them. And I know she'll go into greater depth later. But it's really helpful. Things talking about, the different bills that we're going through, and this will be really helpful when you're speaking to different legislators. on the Hill. And this is my favorite part. So social media, I'm obviously on the marketing team. So social media for us is huge. And we would really, really love to see all of your photos. Please take photos for us, and you can send them to marketing@aarc.org. And we've also included in the toolkits is a social media toolkit as well that'll have different captions you can use, all the hashtags that you can use, and that sort of thing. So that's all in the toolkit as well, available for download. So be sure to reference that. We would also love to see everyone schedule time to take a group photo on the Capitol Hill steps. We're going to be sending a large banner that you guys can hold up and take a couple group photos. That always makes a huge impact on social media and lets other people that maybe didn't get to attend the fly-in see what you're doing and also get excited. So we would love that photo wherever you guys can get it. And in the toolkit also is some really great signs that we're going to be sending there as well. And I'll show you what those look like. We're going to send them in black and white and in color. This was mine I held up, and you can actually write in who you are supporting the SOAR Act on behalf of. I said my grandmother, but these are going to be really great to have with you throughout your time in Washington, D.C. You can take pictures, especially on Capitol Hill. That would be great, but also in different meeting rooms, get together with a group of people and take a photo. And be sure to use the hashtags, which we've placed at the bottom so you guys can't miss them. And that really helps us kind of paint a picture of what's going on and allows us to reshare on social media to share with everyone else. So that is really helpful for us. And then also a document that Miriam had included is the post fly-in. So this is really important for when you guys get home. There's, sending thank you notes to legislators you might have met with, and also a sample press release to send to your local papers, things like that you can reference that'll really kind of make an impact after the fly-in as well. And then finally, a huge shout out also to my colleague, Lisa. She's been really working hard on getting everything up on the website as well. She's really great to work with. So if you have any questions for either of us ahead of time, please send to us. We'd be more than happy to help. But yeah, we are really excited about this and really excited to see what you guys do and really looking forward to seeing pictures. So I'm going to reiterate again, take lots of pictures. And Miriam, I will hand it back over to you.
Okay, so great. You have a couple of comments here. One is Joel Brown said he's so happy to be here and learn from the experts. And Jefferson Mixell from Pennsylvania said he really appreciates the organization of the fly-in page. Thank you for making it so easy. What I'm going to do is ask if there's any questions of Liz right now, and also suggest that if you go to the page and you find something that you wish, or you see something that you don't see something that you wish was there, please send an email to me, send an email to Liz, and we can create that document or expand on a document. As Liz told you, there are a couple of things that we're still planning to add. We have a piece of legislation that was introduced Monday, and we've put up documents that came from Senator Casey's office, but we will write our own talking points from a respiratory therapy perspective. And so you'll see that coming. So Liz, can we take any questions now?
Yeah, absolutely.
From the group?
I'm trying to see if we have any. I believe Daniel Grimm has raised his hand. Let me.
Right.
Hello.
Hi,
Hi,
Dan.
Dan.
Can you?
Yeah.
Hey, I was just wondering about scheduling of meetings. Who's going to be doing the scheduling, and are we going to have a list of meetings when we get there?
So the way that that's done, Dan, is the respiratory therapists who participate in the fly-in schedule their own meetings, and they submit those meetings through a JOT form, and that JOT form then goes into a master list. We put together the meeting list so that we can have leadership join some of the member meetings. And also, Dan, I should introduce you. Dan is an individual who is going to be giving the patient perspective at our fly-in. He's from New York. And Dan, we had planned on pairing you with the New York delegation. And also, if you felt up to it, we would love to have you join some leadership meetings where there might be some members who are present as well, because we know that the voice of the patient really resonates on a lot of these issues. Does that answer the question, or did you have any additional questions or comments?
No, I was just looking for guidance, like if I would have to schedule something or if I'll be just attending with other therapists that have scheduled things.
Yeah, so we would think that you would attend with meetings that are already scheduled,
Okay.
unless there is unless you have a specific relationship with a member and you think that you can get a member level meeting, you can let me know, and we'd appreciate you if you scheduled that for us, and we'll let the New York people know that as well.
Okay. Thank you.
I'm looking. I saw Keith had a comment. When I click on the link to Congressional Office Schedule list on the Setting Up Legislative Meetings page in the toolkit, I get a notice that says I need permission to access it. Keith, I will absolutely address that. I apologize. We will get that fixed immediately. Miriam, I think that's all the questions we have for now. If you want to go into, I can pop up your slides and we can go from there.
And again, guys, there is always a glitch on a website or a link. We've just put all this stuff up there in the past 6 weeks. And so, it's really being tested now. And so anything that you find, let us know and we will make that correction right away.
Yeah, for sure.
So I think as you get my slides up, Liz, thank you very, very much. Thanks for being in the group, and thanks for the work that you do on behalf of the AARC and on behalf of the advocacy.
Happy to do it.
So for our fly-in, our format will be much the same. You can go to the next slide, as it has been in the past. On day one, we start in the afternoon, and then we do a briefing, and that is followed by dinner on your own. A couple of notes that I want to make about the agenda here. One is that we're very fortunate that Heather Wilden is going to come and help us this year. Heather, as you know, is a liaison to the House of Delegates. She knows a lot of people who are coming to the fly-in, and she's just a terrific resource and colleague. And we're really excited that she's coming this year, and she's going to be at the fly-in with us. Heather's going to help with registration, which will open about 11 o'clock. But really, there's not anything more to do since most of you have filled out a JOT form. Just pick up your name tag. Carl will give the welcome along with Dan, some opening remarks, and then we have a box lunch, and then we do a working lunch. We have invited the co-sponsors of the SOAR Act in the House, and that is Representative Valadeo, the Republican from California, and Representative Brownlee, the Democrat from California. Now, they are invited. We don't know whether or not they'll come. If they are not going to be in attendance, what we'll do is we'll start the meeting at 1 o'clock instead of at 12 o'clock. So just so people know, we have some flexibility there. Stephanie Reinhardt will come and give an overview about what we're asking. Dan, as I told you, will give a patient perspective, and his story is very moving. He spent a lot of time being a peer guide to other individuals who have alpha-1 antitrypsin deficiency, a genetic form of COPD. And then we're fortunate this year that Kay Moyer will join us and do a respiratory regulatory affairs overview for us, so that you get a real taste for the scope of work that we do in advocacy and government affairs. And then Mike will be doing a orientation It's a general overview. It's not just for first-time attendees, but it'll be great for a number of the first-time attendees that we have there. And then dinner is on your own. For day 2, what we do is we start off in the morning on the 7th, and we have a hot breakfast. We leave that breakfast open because we know a number of people don't start their meetings until later in the day. So it starts early and ends late. And then we have a dinner debriefing where we have an open mic and we share. It's motivational. It's really a fun time to come to the debriefing dinner. And it's very important for the staff who are there to learn about how your meetings went. We get that feedback from you in the jot forms, but it's also great for us to know if you have qualified leads for us, because we really want to build co-sponsorship on these pieces of legislation. Again, as I mentioned, the agenda is subject to change based on whether or not the congressional invitees are going to show up for us or not. Let me go to the next slide, please, Liz. So the goal for this presentation is to review the priorities, discuss the toolkit, and answer additional questions that you may have. And we hope you'll answer. We hope we'll be able to answer all of your questions. You can type them into the chat, or again, raise your hand and we'll go live at the end of the presentation. Next slide, please. So the first piece of legislation that we're supporting is a new piece of legislation. This was introduced on Monday, April 15th, on tax day, so a few days ago. Senator Bob Casey, along with 25 Senate co-sponsors, introduced the Long-Term Care Workforce Act. What happens within this act is it recognizes the Workforce Diversity Act, that the Allied Healthcare Workforce Diversity Act that was passed, but it was passed without funding. Pages 100 through 106 of the bill, it's a huge piece of legislation, adds funding to the Allied Healthcare Workforce Diversity Act, and this piece of legislation needs significant Republican co-sponsors. So we hope that when you have your meetings, you'll be talking about the need to fund these grants and the $10 million a year request that's being made through appropriations. Even though the Allied Healthcare Workforce Diversity Act was passed, we have been asking for 2 years for appropriations for this grant program through HRSA, and haven't gotten the funding. So it's great that it's been picked up and put into the Long-Term Care Workforce Act. The chances of this piece of legislation passing are very small because it's huge and it doesn't have bipartisan support. But the great news is that this is an initiative that we've worked on for quite some time, and this keeps the ball rolling, keeps it alive. And as I said, pages 100 through 106 of the legislation specifically mention respiratory therapists and the need for funding in this grant program. What we've added to the website today is the text for the bill, which is not listed on congress.gov yet, and the talking points that came from Senator Casey's office. We will add our own talking points from a respiratory therapy perspective, and so you'll see that in the toolkit. And again, the bill number is S4120. Next slide, please, Liz. We want to continue our work, which is part of our strategic plan. Actually, the last piece of legislation is also part of the AARC's strategic plan, and that's to expand access to respiratory therapists outside of the acute care setting. So the Supplemental Oxygen Reform Bill is an opportunity to create a service element that provides reimbursement for respiratory therapists to see patients in their home. The bill numbers for what is called the SOAR Act. In the House, the bill is HR 7829, and in the Senate, S 3821. And the good news is that the text of the legislation is identical in both chambers. So HR 7829 and S 3821 are essentially the same bill, except one's in the Senate and one's in the House, with different sponsorship. So we're seeking co-sponsorship for the bill in the House and the Senate. And one of the things that we're going to do is create recognition certificates for you to thank the sponsors and the co-sponsors of the legislation. So we'll have those printed out and available for you at the fly-in. What this does is it really gives you an opportunity to give another boost in getting a meeting with the member themselves, because they love to be recognized. They love these thank you certificates. They love to take photos with their constituents who come in to present these to them. So we'll have those available for anybody who's been an original sponsor or a co-sponsor of the legislation. To date, the legislation in the House has just had its first co-sponsor that's not an original co-sponsor. So we hope that we'll have more momentum by the time that you get there in a couple of weeks. Mike and I are doing a mini fly-in on Monday, and we've got some congressional appointments scheduled. So maybe we'll have some additional co-sponsors by the time we get to DC on this legislation. Next slide, please. So we hope that you will refer to it by its number and that you'll know its bill number, because there's also another SOAR Act that's in Congress right now, and that's the Simplifying Outdoor Access for Recreation Act. And so we hope you won't just call it the SOAR Act, that you'll call it the SOAR Act for Oxygen Reform and know your bill numbers. Next slide, please. So Senators Cassidy, Warner, and Klobuchar introduced, as you've heard, the SOAR Act. They introduced it first in the Senate. And the important thing when you look at the talking points is to know that this is a piece of legislation that has no known opposition. And in fact, the legislation grew out of a coalition of patients who came together with providers and the durable medical equipment industry itself and created pillars that the legislation is based on. And out of the 4 pillars, the 3rd pillar of reform is creating a statutory service element. Now, this is something that's unique and different. There's never been a service element within the durable medical equipment statute, and this service element specifically names respiratory therapists to ensure that patients have access to their expertise. There have been a lot of questions about what will the payment structure be? How will this be implemented? And again, guys, those are questions that will be left to the federal agency that will have oversight once this legislation is passed. That agency is going to be the Centers for Medicare and Medicaid Services, and that will take place within the DMEPOS section of CMS in the policy section. A number of partners within the coalition, the Oxygen Coalition, have already had meetings with CMS to let them know that we're working on this legislation and to inform them and get some buy-in. And AARC has had meetings with CMS on the legislation, just so you know. The SOAR Act also, in terms of tools, is the most mature piece of legislation that we have in terms of the toolkit. So we have consented all of the people who came together and put the legislation together. We have gone to CMS and had conversations with them. We've got talking points and testimonials from patients. We have what are they called? Infographics that you can use that talk about liquid oxygen. That's part of the toolkit. And the additional piece that we have that we don't have on the other 2 pieces of legislation is a CBO style score. So the Congressional Budget Office always comes together and creates a score for a piece of legislation that needs to be seriously considered. And we have an outside score that's included as part of the toolkit, so you can take a look at that. Next slide, please. And again, in the House, our co-sponsors, Valadeo and Brownlee, have been invited. Dr. Bouchon is retiring next year, but we're really glad that he's added his gravitas to this legislation, as well as Adrian Smith. Next slide, please. Finally, we'll be talking about, as we did last year, the Sustainable Cardiopulmonary Rehab Services in the Home Act. This is a piece of legislation that gives Congress will give the authority to CMS to extend the flexibility that was given during the public health emergency, during the global pandemic of COVID, to provide pulmonary rehab, cardiac and pulmonary rehab services in the home, virtually through telehealth. Those ended on May the 11th, 2023, and HR 1406 and S 3021 simply extends those benefits for patients to receive virtual cardiac and pulmonary rehab in the home. We know that respiratory therapists are providers of these services. Unfortunately, respiratory therapists are not specifically named in the legislation because for pulmonary rehab, they are billed incident to physicians, but we are supporting this legislation and seeking co-sponsors for the bill in the House and the Senate, and we'll have recognition certificates that will be available for you to thank the sponsors and the co-sponsors of this legislation. Next slide, please. So that's it. We have a couple minutes for questions before I turn the program over to, is Marlene next on the agenda, Liz?
She is, but she was not.
She's not available to join us.
Yeah,
so,
she is next on it. Yeah.
Okay, so I have notes from Marlene, but let's see if we have questions first. Anything come in the Q&A?
Let me double check. Let's see. From Natalie Napolitano, if there are patients attending from states that were not organized by the states themselves, it would be good to make the connection as early as it may assist with getting meetings for the patient's elected official.
So that's a really good point, Natalie. We'll make sure that that happens. And then we have a note from Lisa Weisenberger, who says that she was able to fix the link that was pointed out as broken. So she already took care of that. Thanks so much, Lisa. And then Jefferson Mixell has a point of clarification, and that is on the oxygen legislation. The question is, would the legislation require an RT or just allow for payment of an RT services? So the answer is the latter. It will allow for a payment for RT services. It does not make it mandatory that the durable medical equipment suppliers hire or pay an RT. It just provides the payment option. So we hope that that will stimulate the marketplace. Let me go on and answer some questions and give you some information about the hotel, since Marlene, unfortunately, has had an emergency and she's unable to join us. Marlene Garrett is our new Vice President of Meetings, Events, and Business Development. She is not related to Dan, although they share the same last name, probably on the family tree somewhere, but they are not directly related. So Marlene is new to us. She's been doing a great job, but again, she apologizes that she had an emergency. Marlene says there's a complimentary shuttle between the airport and the Westin Crystal City. It's just a mile and a short ride to the Washington Reagan National Airport. The I think I'd be able to say that, right? Complimentary shuttle service to the airport is every 15 minutes between 4:30 a.m. to 8 a.m. and on the hour, every hour, and every half hour to 10:45. The last pickup from the airport from the doors 4 and 7. We'll post that in the toolkit. How about that, Liz? That'll help everybody. Okay. The hotel confirmation, the Westin Crystal City Hotel is sending out hotel confirmations directly to each attendee this week. If you haven't received it, you should soon. Marlene says, please check the spam junk folders in case it hasn't been received. If you don't receive an email confirmation by Monday, April 22nd, contact her directly at marlene.garrett@aarc.org. And again, we'll put her notes into the toolkit. Check-in and checkout dates. If check-in and checkout dates are incorrect, again, please contact Marlene. Expenses. AARC covers the hotel room and tax for the nights of May 6 and May 7. Outside of those dates, you will be on your own. All incidentals will be on your own, and you will settle up incidental expenses and extra nights at the hotel when you check in. Please provide a credit card at the check-in for incidentals. The Westin Crystal City Reagan National Airport Hotel address is 1800 Richmond Highway, Arlington, Virginia, and the meeting rooms will be held in Jefferson 1 and 2 ballrooms. Again, we'll post her notes so that everybody has those in the toolkit so that you can review those if you have any additional questions. With that, it really is my pleasure to turn the program over to our good volunteer, Mike Madison. He's going to go through a few tips and pointers. And there's nothing better than hearing peer-to-peer from your very own respiratory therapy volunteers. So thanks again, Mike.
Thank you, Miriam. Could I get sharing?
Yeah, I believe you should be able to.
It's still asking me for permission.
Okay. Co-host. All right, you should be able to share now.
Okay, yep, that's got it. Okay, can everybody see my screen okay?
Not quite yet.
Oh, is it?
It says you've started screen sharing, but it's just a blank screen. Do you have two monitors maybe?
No, let me stop and try it again.
Yeah, try to reshare.
Sorry about that. Let's try this way. How about now?
Not quite yet. Oh, now we can see it.
Okay. So I'm going to stay, since we apparently have some bandwidth issues, I'm going and we're also short on time, I'm going to stay out of presentation mode, and I'm going to kind of skip to the high points here. So the first point is that, first and foremost, we're respiratory therapists. And so Miriam has alluded to it earlier. We want patient stories. We want to give our elected officials good, clean examples of how this legislation will positively impact the quality of life for our patients. So think of those stories, think of those examples. Remember, stay HIPAA compliant, but we do want to give concrete examples, real life examples to our elected officials. It helps bring the message to them. Along those lines, if you haven't done it before, American Lung Association has a listing. It's by state and by county within the state. So this is Massachusetts, but it lists all the patient population in terms of asthma, COPD, and chronic lung disease and cancer. So each one of these representatives may cover several counties, but bringing that data to them reminds them that they have a constituency that is vulnerable and that this legislation will be helping. And so here's where we stand. Congress.gov is a good place to look at the text for the bills and the latest updates on it. We have co-sponsors, the Allied Health Workforce Diversity Act. As Miriam pointed out, it's 25 co-sponsors, 24 of them are original, and they're mostly Democrats. So we are looking for Republicans to co-sponsor this legislation. The telehealth bill on the House side is fairly balanced. And so if one of your appointments or one of your legislators has already signed on as a co-sponsor, the list is available on congress.gov. Be sure to thank them. And these are the certificates that Miriam was talking about. A thank you certificate for helping support our legislation. And then in terms of logistics, the hotel, as Miriam stated, it's very close to the Crystal City metro station. So where we had to walk several blocks last year, This is an underpass under this busy road, but it's a sidewalk and very close to the metro station. And then we've also got instructions on how best to use the metro. There's a couple of different ways to get there. The easiest is just jump on the blue line and follow it around to South Capitol Metro Station. And we'll dive into that a little deeper. These are the layout or locations of the buildings. The House side is on Independence Avenue, and the Senate side is on Constitution Avenue. And then you'll see, of course, the Capitol and Supreme Court and Library of Congress as additional landmarks. And then here we go. Wear your comfortable shoes. This is just the Cannon House office building in the forefront of this. There's 2 other buildings behind it. They are all connected at the basement level through a walkway. So once you get through security, you have access to all 3 buildings without, again, going back through security. But these buildings are big. So wear good walking shoes and try not to do back-to-back appointments with short time frames. You're going to need a good 15 minutes to get from one office to the next unless they're close by. If you are going from the House building, House side to the Senate side, really try to allow yourself 20 to 30 minutes. It's a good little walk, but the Capitol grounds are beautiful, and so it's quite refreshing to get out there. And then we'll go through this a little more too, but there is a sequence to the room numbers. So in this case, CHOB 1234. So it's the Cannon House office building, and it's first floor, suite 234. So fairly simple, and we'll talk about that a little bit more. And that's going to be about it. Again, important, the jot forms. Once we have the information and we know your appointments, then we can schedule people with first timers, as well as schedule leadership for key meetings. So with that, Miriam, I guess we'll take questions and go from there. Let's see here.
Thank you, Mike.
Yep.
So I think we're going to wrap up here in just a minute. I think you've got one hand up, Liz.
Yep. Kimberly Smith.
Needs to be unmuted.
Pardon me, I don't have a question, but I did want to say, if people are doing virtual meetings, just be mindful of the Wi-Fi situation. We had some issues last year when we did that. So making place for Wi-Fi issues, and also maybe bringing headphones or something so you can do it in the quiet, secure area is a good suggestion.
That's a great suggestion. Thank you. And it's also a reminder to say that we do have a number of people who are doing virtual meetings. And what I've asked is, if you have a virtual meeting that is in conjunction with the fly-in on these issues with your members, please fill out the jot form afterwards. The other thing I want to tell you is, last year we had 68 people who attended the fly-in. This year we have over 100. Last year we had over 230 meetings. This year, I hope that we will have significantly more. I want to thank all of you for your volunteer time. You're just absolutely the best to work with, and I and the staff are here to support you in any way that we can, and to make sure that you're comfortable moving forward. For anybody who hasn't done this before, we always make sure that at least your first meeting you have accompaniment by somebody who is seasoned and done this many times. Also remember that we do a briefing on site, and materials are available to you online at any time. And I guess with that, I think we've answered everything. The question was, will the slides be available? We will upload my slides and Mike's slides right after this presentation. Lisa may have already done it. As far as we know,
working on it.
She's so quick on the trigger, and we're right on the money, Dan, if you want to take it home.
Sure. Thanks again, guys. Really good work here. Such a phenomenal team bringing it all together. And one thing I'll point out, and I'll mention this again when we get to Washington, you know, most of the people you're going to be meeting with are going to be young staffers, like in their 20s, and you're the expert. So just always remember that they look to you as the expert, as the respiratory therapist. So there's no need to be intimidated. In fact, they're going to feel intimidated by you because you're the expert respiratory therapist. So don't forget that. That's a really important key item. So try to minimize your nerves going into it. But I know you guys are going to be great. And again, we have so much to look forward to. And again, I wanted just to thank Miriam, Mike, and Liz, and Lisa for all their hard work. We wouldn't be doing this today if it weren't for all of them. So thanks again, guys. We'll see you in Washington.
Thank you all.
Bye-bye.